finding the doctors hold the discretion of who can receive the shots and when they can get vaccinated.
Brandon Walker live at United Memorial Medical Center in North Houston. So, Brandon, why is that?
Yeah, well, the answer, Keith, is that there just isn't enough version of either version of the vaccine to go around to everyone who would qualify under Phase 1B.
This is supply and demand dependent.
And supply is no match for demand right now, says Dr. Joseph Varone of United Memorial Medical Center. Phase 1 being rolled out drives home that point even further.
What are we talking about? Those people who are over the age of 65, those people that have any pre-existing condition that can put them at higher risk, people that have cancers, people that have uncontrolled sugar diabetes, bad blood pressure issues.
But that's a broad swath, Dr. Varone says, and doctors will have to use their discretion in prioritizing who within that category should be vaccinated first. Inquiries are piling up.
I have probably 500 emails in the last 24 hours of people that say, hey, could you please somehow put us ahead of the, on top of the list.
Yay, we got the vaccine. Calls are pouring into area pharmacies, too. HEB began rolling out Moderna's vaccine to its Houston area pharmacies today. HEB is not in Phase 1B currently. It's vaccinating healthcare workers solely till otherwise advised. No walk-ins, vaccinations by appointment only.
We will have a electronic sign-up system set up.
Texas's version of 1B differs from the CDC's recommendations on a few points. The biggest is not including what's referred to as essential frontline workers, police, teachers, others. Kevin Hattery is CEO of the Boys and Girls Clubs of Greater Houston. Its 200 or so employees have been working with children throughout the pandemic.
We would like to be considered along at the same time that the education sector is considered in terms of being part of the early prioritization for the vaccine.
Some states are prioritizing their lineup based on supply along with need, and some a tightrope.
We're going to have to be very intentional about who we reach out to initially. And so we'll be reaching out to our patients, and it will be by a scheduled process only.
And Dr. James McCarthy, their chief physician executive for Memorial Hermann Hospital, adds, however, that they are still in the first rollout, Phase 1A. When they get to Phase 1B, they will start contacting those patients. And he says down the line, what he hopes to do is have drive-through locations for people to get vaccinated. Dr. Varone wants to do that, too, in parking lots just like this one. Live on the north side tonight, I'm Brandon Walker, KPRC Channel 2 News.
All right, Brandon, thank you.